Good morning everyone. Today's class is on infection control. It will be discussed under following contents. The contents are introduction, vaccines for dental healthcare workers, personal barrier techniques for infection control, use and care of sharp instruments and needles, sterilization or disinfection of instruments, cleaning and disinfection of dental unit, disinfection of dental laboratory, use and care of handpieces, handling of biopsy specimens, use of extracted teeth in dental educational settings. Coming to introduction, as all infected patients cannot be identified by medical history, physical examination or laboratory tests, Centers for Disease Control and Prevention recommends that blood and body fluid precautions be used consistently for all the patients. These precautions are referred to as universal precautions and must be observed routinely in the care of all dental patients. Infection is the process of invasion of tissue by organisms which are characterized by their multiplication in the body of the host to produce disease. Infection control encompasses the process and activities that identify and reduce the risks of acquiring and transmitting endemic or epidemic infections among individuals. Infection control addresses factors related to the spread of infections within the healthcare setting, including prevention, monitoring, investigation of demonstrated or suspected spread of infection within a particular healthcare setting, and management. Vaccines for dental healthcare workers. Vaccines play an important role in the infection control process. Several vaccines help in prevention of diseases. Here are some examples of these immunizing agents like BCG vaccine, MMR vaccine, Hepatitis-B, C, A vaccines, influenza vaccine, etc. However, blood-borne pathogens exist for which there is no vaccine, including HIV and non-A, non-B hepatitis. Hence, proper infection control procedures are therefore recommended to prevent transmission of such pathogens. Post-exposure prophylaxis is something that is done after being exposed to the pathogen. In some cases where vaccines do not exist, post-exposure prophylaxis is another method for protecting the healthcare workers exposed to a life-threatening infectious disease. For example, the viral particles of HIV-AIDS can be precipitated out of the blood through use of an antibody injection if given within 4 hours of a significant exposure. Personal barrier techniques for infection control. Hand washing, gloves, gowns, masks, eyewear, rubber dam, and personal protective equipment. Hand washing should be done after touching contaminated objects with bare hands. And hand washing should be done before placing gloves and after treating the patient and removing the gloves. Soap and water will remove transient microorganisms acquired directly or indirectly from patient contact. Therefore, for many routine dental procedures such as examinations and non-surgical techniques, hand washing with plain soap is adequate. For surgical procedures, an antimicrobial surgical hand scrub should be used. Hand rubbing is more efficacious than hand washing for the decontamination of healthcare workers' hands following contact with the patients and patient's environment. Hand cleansers containing a mild antiseptic like 3% chloro meta-xylenole or chlorhexidine are preferred to control consistent pathogens and to suppress overgrowth of skin bacteria. Alcohol-based hand sanitizers have rapid and effective antimicrobial action. Gloves for protection of personnel and patients in dental care settings. Medical gloves always must be worn by dental healthcare workers when there is a potential for contacting blood contaminated saliva or mucous membranes. Non-sterile gloves are appropriate for examinations and other non-surgical procedures. Sterile gloves should be used for surgical procedures. There are 4 types of gloves used in dentistry. They are sterile surgical gloves, which are of high quality and expensive, used when maximum protection is required. Latex gloves, not used commonly adversely affected by alcohol, soaps and detergents. Vinyl gloves, which are referred to as over gloves, they are used when intraoral procedures have to be interrupted for a brief time. Heavy utility gloves are worn when handling contaminated sharp instruments, and these are wear and tear resistant. Gowns. The general recommendations for clinical wear include reusable or disposable gowns and laboratory coats or uniforms. Reusable protective clothing should be washed using a normal laundry cycle according to the instructions of detergent and machine manufacturers. Protective garments and devices should be removed before personal exit. Areas of dental office used for laboratory or patient care activities. Masks. It is an important barrier providing protection from inhalation of aerosols generated by high-speed handpiece and air syringes. When a mask is used, it should be changed between patients or during patient treatment if it becomes wet or moist. Face shields or protective eyewear should be washed with an appropriate cleansing agent and when visibly soiled, disinfected between the patients. Eyewear. Eyewear can prevent bacterial or viral contact with eye by aerosol spray and droplet infection. Head covers, they are used during splashing of body fluids and blood. Shoes are kept at office after work. And rubber dam. Rubber dam has been shown to be an effective barrier to reduce the number of organisms in aerosols and also shown to prevent aerosolization of saliva and should be used whenever possible. In addition, high volume evacuator and low volume saliva ejector helps in minimizing contact with aerosols and splatter. Patient rinsing their oral cavities with an antiseptic solution just before treatment has been shown to reduce the number of bacteria that exit oral cavity during operatory procedures. Personal protective equipment. Personal protective equipment is specialized clothing or equipment worn by worker for protection against a hazard. The personal protective equipment prevents contact with potentially infectious material by creating a physical barrier between the potential infectious material and healthcare worker. The components of personal protective equipment include gloves, gowns, bonnets, shoe covers, face shields, CPR masks, goggles, surgical masks, and respirators. Use and care of sharp instruments and needles. Sharp instruments like used needles, scalpel blades, wires contaminated with patient blood and saliva should be considered as potentially infective and handled with care to prevent injuries. Used needles should never be recapped or otherwise manipulated utilizing both hands or any other technique that involves directing the point of the needle towards any part of the body. Either a one-handed scoop technique or a mechanical device designed for holding the needle sheath should be employed. Use disposable syringes and needles, scalpel blades and other sharp items should be placed in appropriate puncture-resistant containers. Bending or breaking of needles before disposal requires unnecessary manipulation and thus is not recommended. Before attempting to remove needles from non-disposable aspirating syringes, dental healthcare workers should recap them to prevent injuries. For procedures involving multiple injections with a single needle, the unsheathed needle should be placed in a location where it will not be contaminated or contribute to unintentional needle stick between injections. Thank you, and other part of the seminar will be continued in the next class.